Hello, my name is Rachel Torrey, and I am a counselor at A Better Today Recovery Services. In this module, we will be discussing how trauma and substance abuse influence and challenge one another in addiction. What is PTSD, and how does it relate to substance abuse? Post-traumatic stress disorder is a disorder which develops in some people who have experienced one or more shocking, scary, or dangerous events. The connection between trauma and PTSD is that trauma often is the root of the intense emotional distress and anxiety of PTSD. When a person goes through life with untreated trauma, they run the risk of developing PTSD, and it is the symptoms of PTSD which lead a person to self-medicating. Too often, we see patients with untreated trauma that have led into their addiction. Symptoms such as night terrors, flashbacks, emotional distress, anxiety, and depression will haunt a person struggling with PTSD and can be debilitating for many people. It may cause them to isolate themselves, struggle with fitting in, and sometimes become violent when forced to relive the traumatic experience in their head. At A Better Today, we emphasize the patient-centered and trauma-informed approach when it comes to treating patients who are struggling to overcome their addiction, as well as to begin working through their challenges related to PTSD. The patient-centered approach emphasizes the importance of an individualized treatment plan. We develop an individualized treatment program which is influenced by the patient's needs, co-occurring disorders such as PTSD or depression, their drug or drugs of choice, and the severity of their addiction. A trauma-informed approach realizes the widespread impact of trauma and understands potential paths for recovery and recognizes the signs and symptoms of trauma in patients, family, staff, and others involved in the system. Trauma-informed professionals respond to patients by fully integrating knowledge about trauma into policies, procedures, and practices, and actively seek to resist re-traumatization into their individualized treatment programs. By utilizing these methods of treatment, our therapists can provide our patients with a safe, non-judgmental environment to open up and to identify what triggers these traumatic experiences and how this leads to self-medication. We teach our patients how to process their feelings and memories in a healthy, proactive way while feeling supported throughout their time here. At ABT, we recognize it is natural to feel afraid during and after a traumatic situation, and we are aware fear triggers many split-second situations in the body and brain to help defend against danger or to avoid it. This fight-or-flight response is a typical reaction meant to protect a person from harm. Individuals who have PTSD may feel stressed or frightened even when they are not in danger. It is that unwarranted anxiety which is associated with PTSD and forces them to feel unnecessary stress. Since trauma and substance abuse influence the severity of one another, it is important to offer treatment which addresses both issues. At ABT, we realize trauma is often at the root of substance dependence, and as trauma-informed providers, we are here to provide a supportive, empathetic, and respectful environment in efforts to support those in need of recovery and sobriety. Thank you for watching. Feel free to like, share, or subscribe below. If you or a loved one is struggling with substance abuse, reach out and contact us today. Stay tuned for more videos.